Doctor, let me move on, if I may. The importance of implementing health information technology. I know there seems to be, from what little I know about it, there's a push going on to get all the physicians, all of the hospitals, all the clinics under this I'll call it an electronic umbrella for lack of a better word. I think it's important, but I have heard in speaking directly with physicians that it is very expensive for them. Would you comment on the whole? Because I think it's great, especially in script where you don't get a problem. You don't have a problem with a doctor that's written it fast, and the pharmacist is reading it fast, and we have a problem. This way, the electronic, it's spelled out. Am I right? Please.
Absolutely. Again, you can ask my department how every time I have to write something, they say, "Is this the doctor's writing again?" Because no one can understand what I'm writing. So yes, it's when you talk about health information technology from a overall sense, we as a state are really at the forefront of what we want to do. The governor has appointed a coordinator that reports right to him, and she coordinates all the health information technology activity that's happening around the state and through the sister agencies. So there are 3 sister agencies that work closely together. It's health, it's human services, and banking and insurance. So those are the 3 departments that work together on this, in addition to the other agencies at the state. And one of our core missions is not only to ensure that Medicaid patients start converting into an electronic health data set, but at the same time we're increasing the adoption when it comes to health information technology for both physicians and hospitals. The time is now because incentives are there. For any physician, you can get anywhere between $44,000 to almost $64,000 in grants from the federal government to help implement that. And again, if by 2015 it's not implemented in a physician's office, you have the potential of actually getting a cut in reimbursement. So you're going to have a penalty as a result of it. Hospitals also have great incentives when it comes to implementing health information technology, anywhere between $2 to $8 million. So the time is there, the need is there. And the need, again, as a physician, I can tell you, I've trained primarily with health information technology when I trained at the VA during my residency training, and now most recently as I've been seeing patients. So when I see a patient, even if I've never seen that patient before, because as you know, I used to, I work on weekends at the VA hospital. So even if I haven't seen a patient, I have all the relevant pieces of information at my fingertips as a result of health information technology. So when we talk about what's broken in our healthcare system, when we're talking about the importance of care coordination, the importance of reducing waste and redundancy, the importance of actually looking at your practice and seeing how you are with quality metrics, the importance of practicing medicine based on guidelines. I mean, there have been reports where it takes 17 years from something to be proven to be a standard of care to actually being implemented in a practical setting in a physician's office. So to wait 17 years to be adopting what should change your outcomes when it comes to your clinical conditions is something that obviously is unacceptable. But health information technology helps to expedite all that. So it's key. It truly is the nexus for transforming our healthcare delivery model. And I am really excited about it. I know it needs a lot of, a steep learning curve, a lot of commitment. And it also does require practice, redesign and re-engineering on the part of both physicians and hospitals. But at the end of the day, it's going to be what we need in order to transform our healthcare system.